This video we are going to talk about the whooping cough or the pertussis. What is the whooping cough or the pertussis? What is the causes? How it can transmitted and how it can prevented. The whooping cough are also known as pertussis. Whooping cough is an extremely contagious respiratory tract infection. Before the vaccine was created, whooping cough was thought to be a childhood illness in many cases. It is characterized by a strong hacking cough that is followed by a high-pitched breath intake. That sounds like a whoop. The causes of the whooping cough is the Bordetella pertussis. This is a type of bacteria that causes the whooping cough. The little droplets full of germs are released into the air when an infected person coughs or sneezes, and it entering the lungs of anyone who happens to be close. How does whooping cough transmitted? The whooping cough is caused by bacteria that are easily transferred from person to person through the air. A whooping cough sufferer may cough or sneeze and discharge microscopic particles containing the bacterium. The microorganisms are subsequently breathed in by other people. Coughing and sneezing are common ways for the germs that cause whooping cough to travel from person to person, even while they may not be aware that they have whooping cough due to minor symptoms. Some people can still transmit the bacteria that causes it to others, especially to the infants. The sign and the symptoms. At first, whooping cough has the same symptoms as the average cold. Mild coughing, the sneezing, runny nose, and low fever as in below 103 degrees Fahrenheit. How to prevent the whooping cough? So the best way to prevent the whooping cough is to get vaccinated. So to prevent the whooping cough naturally, you should make sure that the air was clean. Also keep your home free of allergens like tobacco smoke and fireplace fumes that can cause a coughing fits. To stop the transmission, also cover your cough and wash your hands frequently. Also wear a mask if you have to be around people. Whooping cough is treatable and preventable with antibiotics. The Decalithromycin, erythromycin, and azithromycin are among the antibiotics that are advised. You can also use the trimethoprim, sulfametazole, and also you can go to a doctor to check you up and let your doctor give you an antibiotics to prevent or to fight the whooping cough or the pertussis.